A patient's family requests to be present during an emergent resuscitation attempt. Family presence during CPR. The nurse's most appropriate action, per current evidence-based practice, is to a. Automatically deny the request regardless of circumstances. b. Assign a support person to accompany the family, explain what they will see, and allow presence if the family desires and it does not compromise the resuscitation. c. Allow the family to actively participate in performing chest compressions. d. Ignore the family's request entirely without any response. The correct answer is: assign a support person to accompany the family, explain what they will see, and allow presence if the family desires and it does not compromise the resuscitation. Current evidence supports offering family presence during resuscitation when feasible, with a dedicated support person to explain events and provide support, as this has been shown to help with family coping and grief processing without compromising resuscitation quality. During auscultation, the nurse hears a harsh, crescendo to crescendo systolic murmur best heard at the right upper sternal border radiating to the carotids. This finding is most consistent with a. mitral regurgitation, b. aortic stenosis, c. tricuspid regurgitation, d. mitral valve prolapse. The correct answer is aortic stenosis, a crescendo to crescendo systolic murmur at the right upper sternal border radiating to the carotids is the classic auscultatory finding of aortic stenosis caused by turbulent flow across a narrowed valve. A patient recovering from major trauma is at risk for venous thromboembolism. The nurse anticipates prophylactic measures will likely include a. strict bed rest with no mechanical or pharmacologic prophylaxis, b. a combination of mechanical prophylaxis, sequential compression devices, and pharmacologic prophylaxis is appropriate for the patient's bleeding risk. c. Pharmacologic prophylaxis only with mechanical devices contraindicated. d. No VTE prophylaxis is needed in trauma patients. The correct answer is a combination of mechanical prophylaxis, sequential compression devices, and pharmacologic prophylaxis as appropriate for the patient's bleeding risk. VTE prophylaxis in trauma and immobile patients typically combines mechanical devices SCDs with pharmacologic anticoagulation when bleeding risk allows, following evidence-based protocols to reduce the high risk of thromboembolism in this population. The NIH stroke scale NIS is used by the progressive care nurse primarily to a. diagnose the type of stroke ischemic versus hemorrhagic, b. quantify the severity of neurologic deficit and monitor for changes over time, c. determine the patient's baseline cognitive function prior to hospitalization, d. assess nutritional status. The correct answer is quantify the severity of neurologic deficit and monitor for changes over time. The NIS is a standardized tool that quantifies stroke severity through a structured neurologic exam, allowing consistent tracking of improvement or deterioration. It does not by itself distinguish ischemic from hemorrhagic stroke. A patient with COPD is prescribed a long-acting muscarinic antagonist LAMA inhaler. The nurse explains this medication works primarily by a. blocking acetylcholine-mediated bronchoconstriction to promote bronchodilation, b. reducing airway inflammation directly like a corticosteroid, c. increasing mucus production, d. stimulating beta-2 receptors exclusively. The correct answer is blocking acetylcholine-mediated bronchoconstriction to promote bronchodilation. Long-acting muscarinic antagonists block acetylcholine at muscarinic receptors in the airway smooth muscle, reducing cholinergic-mediated bronchoconstriction and providing sustained bronchodilation in COPD management. A nurse observes that patients from a specific rural area consistently arrive later in their disease course due to limited access to primary care. Systems thinking applied to this observation would involve a. assuming this pattern is unrelated to systemic access issues, b. identifying and potentially advocating for improved access to primary and preventive care resources for that population, c. ignoring the pattern since it occurs outside the hospital, d. blaming the patients for delayed presentation. The correct answer is identifying and potentially advocating for improved access to primary and preventive care resources for that population. Systems thinking recognizes how broader healthcare access issues, including those outside the hospital, affect patient outcomes and supports advocacy for improved access at a population level. A patient with severe mitral stenosis is assessed by the nurse. Which auscultatory finding would the nurse expect? A. A low-pitched, rumbling diastolic murmur best heard at the apex with the patient in the left lateral position. B. A crescendo-to-crescendo systolic murmur at the right upper sternal border. C. A continuous machinery murmur. D. A holosystolic murmur radiating to the axilla. The correct answer is a low-pitched, rumbling diastolic murmur best heard at the apex with the patient in the left lateral position. Mitral stenosis produces a characteristic low-pitched, rumbling mid-diastolic murmur best heard at the apex, often accentuated with the patient in the left lateral decubitus position, reflecting turbulent flow through the narrowed valve. A patient develops sudden severe tearing chest and back pain radiating between the scapulae. Blood pressure is markedly different between the right and left arms. The nurse should suspect A. Acute pericarditis. B. Aortic dissection. C. Pulmonary embolism. D. Esophageal spasm. The correct answer is aortic dissection. Tearing interscapular pain with a significant blood pressure differential between extremities is a hallmark presentation of aortic dissection and warrants emergent imaging rather than anticoagulation. Following an uncomplicated diagnostic left heart catheterization via the right femoral artery, the nurse notes a firm, pulsatile mass with an audible bruit at the insertion site. This finding is most consistent with A. A normal hematoma. B. Pseudoaneurysm formation. C. Retroperitoneal bleeding. D. Arterial thrombosis. The correct answer is pseudoaneurysm formation. A pulsatile mass with an audible bruit at a femoral access site indicates a pseudoaneurysm, in which blood leaks from the artery into a contained space that continues to communicate with arterial flow. Which nursing action is a core component of CLABSI prevention bundles for a patient with a central venous catheter? A. Changing the dressing only when visibly soiled, regardless of schedule. B. Performing daily review of line necessity and prompt removal when no longer needed. C. Avoiding chlorhexidine skin antisepsis during dressing changes. D. Leaving the insertion site uncovered at all times. The correct answer is performing daily review of line necessity and prompt removal when no longer needed. Daily assessment of central line necessity with prompt removal, along with sterile insertion technique, chlorhexidine antisepsis, and proper dressing care, are core elements of CLABSI prevention bundles. A patient's rhythm strip after a recent pacemaker implantation shows pacer spikes followed consistently by QRS complexes, with the paced rate matching the programmed rate. The nurse documents this as A. Normal pacemaker capture and function. B. Failure to capture. C. Failure to sense. D. A lead fracture. The correct answer is normal pacemaker capture and function. Consistent pacer spikes followed by appropriate QRS complexes at the programmed rate indicates normal pacemaker capture and function, the expected finding after successful implantation and appropriate device programming. A patient receiving fibrinolytic therapy for a STEMI develops signs of reperfusion, including resolution of chest pain and a specific dysrhythmia. The nurse recognizes which rhythm is a classic reperfusion or arrhythmia. A. Accelerated idioventricular rhythm. B. Complete heart block. C. Atrial fibrillation with rapid ventricular response. D. Asystole. The correct answer is Accelerated idioventricular rhythm. Accelerated idioventricular rhythm is a classic, generally benign, and self-limited reperfusion arrhythmia seen after successful thrombolysis or PCI, reflecting restored blood flow to previously ischemic myocardium. A patient with a family history of sudden cardiac death at a young age is being evaluated for a possible inherited channelopathy or cardiomyopathy. The nurse anticipates that genetic counseling and screening may be recommended for a first-degree relatives, given the heritable nature of many of these conditions. B. No other family members, since these conditions are never heritable. C. Only the patient's children, excluding parents and siblings. D. Distant relatives only, excluding immediate family. The correct answer is first-degree relatives, given the heritable nature of many of these conditions. Many inherited channelopathies and cardiomyopathies associated with sudden cardiac death follow familial inheritance patterns, so genetic counseling and cascade screening are typically recommended for first-degree relatives to identify others who may be at risk. A patient with a tracheostomy and a Passy-Muir speaking valve in place suddenly develops respiratory distress. The nurse's priority action is to A. Immediately remove the speaking valve and assess the patient's airway and respiratory status. B. Increase the oxygen flow through the valve without further assessment. C. Leave the valve in place and wait to see if symptoms resolve. D. Reposition the patient without removing the valve first. The correct answer is immediately remove the speaking valve and assess the patient's airway and respiratory status. Respiratory distress in a patient with a speaking valve requires immediate removal of the valve to open the tracheostomy for direct airflow, followed by prompt assessment, since the valve can contribute to air trapping or the patient may need direct suctioning or ventilatory support. A patient with acute pericarditis is prescribed NSAID and colchicine. The nurse explains that this combination is used to A. Reduce inflammation and pain while decreasing the risk of recurrence. B. Treat an underlying bacterial infection. C. Lower blood pressure. D. Prevent dysrhythmias directly. The correct answer is reduce inflammation and pain while decreasing the risk of recurrence. NSAID and colchicine are first-line therapy for acute idiopathic or viral pericarditis, working to reduce inflammation and pain, while colchicine specifically has been shown to reduce the risk of recurrent pericarditis. A nursing journal club on the unit regularly reviews and discusses recent research articles relevant to progressive care nursing practice. This activity primarily fosters A. Clinical inquiry by promoting engagement with current evidence. B. Response to diversity. C. Advocacy agency exclusively. D. An activity with no clear connection to professional practice. The correct answer is clinical inquiry by promoting engagement with current evidence. Journal clubs actively engage staff with current research literature, directly supporting the clinical inquiry characteristic by fostering a culture of ongoing questioning and evidence-based practice. A nurse implements an early mobility protocol for a mechanically ventilated patient as soon as it is deemed safe. This intervention is primarily aimed at reducing the risk of a ICU-acquired weakness, delirium, and other complications of prolonged immobility. B. Cardiac dysrhythmias exclusively. C. Renal failure exclusively. D. Hepatic dysfunction exclusively. The correct answer is ICU-acquired weakness, delirium, and other complications of prolonged immobility. Early mobility protocols, even for mechanically ventilated patients, have been shown to reduce ICU-acquired weakness, delirium duration, and other complications associated with prolonged bed rest and immobility, supporting better functional recovery. A patient with recurrent aspiration events despite a PDG tube for feeding is being reassessed by the nurse. The nurse understands that aspiration can still occur in a patient with a PDG tube due to A. Aspiration of oral secretions or refluxed gastric contents, which a PDG tube does not fully prevent. B. The PTG tube itself causing direct lung injury. C. An inability of the PTG tube to deliver adequate nutrition. D. Aspiration is impossible once a PTG tube is placed. The correct answer is aspiration of oral secretions or refluxed gastric contents, which a PTG tube does not fully prevent. A PTG tube reduces but does not eliminate aspiration risk, since patients can still aspirate oral secretions or gastric contents that reflux upward, requiring ongoing measures like head-of-bed elevation and oral care, even after gastrostomy tube placement. A nurse caring for a patient nearing the end of life ensures the room is quiet, provides frequent oral care, and repositions the patient gently for comfort rather than for medical necessity alone. This reflects the caring practice's goal of curing the underlying disease. B. Promoting comfort and preventing unnecessary suffering. C. Meeting only regulatory documentation requirements. D. Minimizing family involvement. The correct answer is promoting comfort and preventing unnecessary suffering. These interventions reflect the core aim of caring practices, promoting comfort and healing while preventing unnecessary suffering, which becomes especially central during end-of-life care when cure is no longer the goal. A patient on mechanical ventilation is being assessed for readiness to wean. Which finding would most support proceeding with a spontaneous breathing trial? A. Rapid shallow breathing index RSBI greater than 105. B. FiO2 requirement of 60 with PEEP of 12. C. Hemodynamic instability requiring vasopressor titration. D. Adequate oxygenation on minimal ventilator settings, hemodynamic stability, and ability to initiate a breath. The correct answer is adequate oxygenation on minimal ventilator settings, hemodynamic stability, and ability to initiate a breath. Standard weaning readiness criteria include adequate oxygenation on low support, hemodynamic and respiratory stability, and intact respiratory drive. A high RSBI and ongoing hemodynamic instability suggests the patient is not ready. A patient with a history of recurrent aspiration pneumonia due to dysphagia is being evaluated for a percutaneous endoscopic gastrostomy PTG tube. The nurse explains the primary purpose of this intervention is to A. Provide a route for enteral nutrition that bypasses the risks associated with oral intake in patients with significant aspiration risk. B. Cure the underlying swallowing disorder. C. Eliminate the need for any further swallowing evaluation. D. Provide a route for medication administration exclusively, with no nutritional purpose. The correct answer is provide a route for enteral nutrition that bypasses the risks associated with oral intake in patients with significant aspiration risk. A PTG tube provides a route for long-term enteral nutrition in patients with significant, persistent aspiration risk from dysphagia, though it does not eliminate all aspiration risk, for example from reflux, or cure the underlying swallowing disorder. A patient with septic shock requires broad-spectrum antibiotics. The nurse understands that delaying antibiotic administration beyond the first hour of recognized septic shock is associated with A. No measurable effect on outcomes. B. Increased mortality with each hour of delay associated with worsening survival. C. Improved outcomes due to more targeted therapy. D. Decreased risk of antibiotic resistance only. The correct answer is increased mortality with each hour of delay associated with worsening survival. Multiple studies have demonstrated that delays in antibiotic administration and septic shock are associated with progressively increased mortality, underscoring the urgency of prompt antibiotic delivery within the first hour of recognition. A patient with long-standing, poorly controlled hypertension and diabetes is found to have significant left ventricular hypertrophy on echocardiogram. The nurse understands that this structural change increases the patient's risk for dysrhythmias, diastolic dysfunction, and progression to heart failure. B. No additional cardiovascular risk. C. Improved cardiac reserve and function. D. A condition that always regresses without treatment. The correct answer is dysrhythmias, diastolic dysfunction, and progression to heart failure. Left ventricular hypertrophy from chronic pressure overload increases myocardial oxygen demand, promotes diastolic dysfunction, and raises the risk of dysrhythmias and progression to heart failure, making blood pressure control important for reducing or preventing further hypertrophy. A patient with long-standing atrial fibrillation undergoes a left atrial appendage closure device implantation. The nurse explains the purpose of this device is to a. Reduce the risk of stroke by preventing thrombus formation and embolization from the left atrial appendage, as an alternative to long-term anticoagulation. B. Cure atrial fibrillation permanently. C. Restore normal sinus rhythm. D. Replace the need for rate control medications. The correct answer is reduce the risk of stroke by preventing thrombus formation and embolization from the left atrial appendage, as an alternative to long-term anticoagulation. Left atrial appendage closure devices are used in select atrial fibrillation patients who cannot tolerate long-term anticoagulation, sealing off the appendage, the most common site of thrombus formation, to reduce stroke risk without ongoing anticoagulant therapy. Following successful resuscitation from cardiac arrest, the patient remains comatose. The nurse anticipates the team will likely initiate which evidence-based intervention to improve neurologic outcomes? A. Targeted temperature management therapeutic hypothermia. B. Immediate rewarming to hyperthermic levels. C. Withholding all further care. D. Aggressive hyperventilation as a standard post-arrest strategy. The correct answer is targeted temperature management therapeutic hypothermia. Targeted temperature management has been shown to improve neurologic outcomes in comatose survivors of cardiac arrest by reducing cerebral metabolic demand and secondary neuronal injury during the post-arrest period. A patient with cirrhosis develops hepatorenal syndrome. The nurse understands this condition is characterized by a. Progressive kidney failure due to severe liver disease, without primary intrinsic kidney pathology. B. A primary kidney disease unrelated to liver function. C. Improvement in kidney function as liver disease progresses. D. An infectious process of the kidneys. The correct answer is progressive kidney failure due to severe liver disease, without primary intrinsic kidney pathology. Hepatorenal syndrome is a form of functional renal failure that develops in the setting of advanced liver disease and portal hypertension, characterized by renal vasoconstriction without primary intrinsic kidney damage. A patient with a history of chronic hepatitis C is found to have new ascites, jaundice, and confusion. The nurse recognizes this progression is most consistent with a. Decompensated cirrhosis, reflecting progressive loss of hepatic synthetic and detoxification function. B. Acute hepatitis infection. C. Resolution of the underlying liver disease. D. An unrelated new diagnosis. The correct answer is decompensated cirrhosis, reflecting progressive loss of hepatic synthetic and detoxification function. The development of ascites, jaundice, and encephalopathy in a patient with chronic liver disease marks the transition from compensated to decompensated cirrhosis, reflecting significant progressive loss of hepatic function. A patient nods along during discharge teaching, but later asks a question that reveals a significant misunderstanding of the material. This scenario illustrates the importance of assuming non-verbal cues like nodding indicate full comprehension. B. Using teach-back or return demonstration to verify actual understanding rather than relying on passive cues. C. Avoiding any further clarification once initial teaching is complete. D. Reducing the amount of information taught in future sessions only. The correct answer is using teach-back or return demonstration to verify actual understanding rather than relying on passive cues. Nonverbal cues such as nodding are unreliable indicators of comprehension. Teach-back or return demonstration provides a more accurate assessment of whether learning has actually occurred. A patient's family requests an autopsy be performed after the patient's death to better understand the cause. The nurse's most appropriate action is to A. Tell the family autopsies are never performed. B. Provide accurate information about the autopsy process and facilitate the request through appropriate hospital procedures. C. Discourage the family from pursuing an autopsy. D. Perform the autopsy request process without informing the provider. The correct answer is provide accurate information about the autopsy process and facilitate the request through appropriate hospital procedures. Supporting a family's request for an autopsy involves providing accurate information about the process and facilitating the request through appropriate institutional procedures, respecting the family's need for understanding and closure. A family member asks the nurse to withhold a terminal diagnosis from a cognitively intact patient to protect them. The nurse's most appropriate response reflects the ethical principle of a beneficence overriding all patient autonomy. B. Respecting the patient's autonomy and right to information about their own condition, while exploring the family's concerns. C. Immediately disclosing full details without regard to family concerns or patient readiness. D. Deferring entirely to family wishes over the patient's rights. The correct answer is respecting the patient's autonomy and right to information about their own condition, while exploring the family's concerns. A cognitively intact patient has the right to information about their own diagnosis. The nurse should explore the family's concerns compassionately while supporting the patient's autonomy, often facilitating a family meeting with the care team. How many did you get right? Let us know in the comments, and tell us what topics you want us to cover next. Want to practice more? Download the app and get hundreds of free practice questions with detailed explanations.